Good morning. Today is Saturday, July 8, 2023. Today is our regular yoga therapy class. Let me do a little sound check first. That should help us. Let's go here. Here it is. Okay, check, check, check. Where it is. Okay, let me be sure. Check, check, check. Okay, let me be sure. Okay, sound is good. Our video is having little distortion these days, but that's from Facebook. Okay. Okay, we're all set. So this is our regular yoga therapy class, and as you know, we have been doing it for a long time. It was in person before the pandemic, and after pandemic it became virtual. This year we started the sequence of classes based on our experience and based on our research. But primarily this is our experiential from all the people who have been practicing with us. We have started how to start a asana practice, pranayama practice, meditation practice. Then we went to the common diseases like metabolic syndrome, which consists diabetes, hypertension, and diabetes, hypertension, and coronary artery disease, and your dyslipidemia, or high lipids, and your high triglyceride and low HDL. We started with all the musculoskeletal disorders and primarily causing chronic pain, and we have gone through the therapy for chronic pain and multiple musculoskeletal disorders like chronic low back pain, chronic upper back pain, frozen shoulder pain, neck pain, went through your hand pain. And our next very important subject in yoga therapy is a balance. So today's topic we picked up, yoga therapy for better balance. What is the problem with our seniors? You know, we don't get older anymore, we get younger. Seniors, mature, more experienced people, is the fall. And before the fall is the fear of fall. And fall is the cause of death for senior people. If you fall down, either break your hip or break your pelvis, doesn't matter what you do. You do immediate nailing of the fractured hip, which is generally at the neck of the humerus, or fix the pelvic fracture. The outcome is not good. And another issue is the people who are at this age, they also have a multiple chronic diseases, and many of them are on anti-platelet therapy. Anti-platelet means we call it blood thinner, like aspirin, Plavix. There are a lot of other in the market. So what happens if you miss one step and a fall which looks a very minor for, we call it a regular people, but it becomes a serious event because they are on a blood thinner, they ended up with a intracranial hemorrhage, that means bleeding in the brain, or called a subdural hematoma, which is the bleeding little outside the brain but inside the skull. And essentially it was the terminal event. People walk. When they walk, you will see they're walking as if they have a fear of fall. Another one, using a stick in one hand. You will see all the people are using a stick in one hand. Please, please, please don't use a stick in one hand. It will create your more imbalance. If you want to carry a stick to protect yourself from a animal or from something, but a stick in one hand is not for your balance. If you need anything for your balance, you need to use your both hands and will be using as a walker. And the best way, I try everybody, that when you are in the grocery store, put your hand in the grocery cart and push the cart and see how much excuse me, how much improvement you make in your balance. Sorry, we do every morning jalneti, wash our nose, and some of the water comes back from the sinuses. So use both your hands as a walker. Do not use one stick for your balance. You can use it for multiple other things. So what is the importance of balance? Most important thing about balance is that a practice of yoga is to improve your health. There are two outcomes of practice of yoga. The first one is called the treatment of disease, called Rogir Chikitsha. Next one is maintenance of health, Shastharokha. The maintenance of health is like your, like a antivirus software. It doesn't let the disease come to you. Health is defined in yoga is a balance of your body, mind and spirit. So just having a balance. Why do we lose our balance? There is a lot of theory behind it. The first Western medical concept is there is an imbalance between the muscle tone. One muscle becomes weak, another muscle becomes stronger, and there is an imbalance between your posture. In yogic explanation of losing your balance is that you are using one half of your brain, which is called lateralized. That means I'm right-handed, I'm using my right hand, right foot all the time, and I'm using my left side of the brain. My right side of the brain is not working at all. So the first thing to get a healthy start, to get the balance back, which we have done and we recommend to other people is an amazing, amazing practice. Daily practice. If you're right-handed, use your left-handed for everything. You try. You have not used it in a long time, you try. Or another way, when you do practice for yoga therapy, please always try to do with your health tracker. Because this will give you a guide what is happening to you. So the first possible first possible balance is, which we ask you, which you started, very effective. Brush your teeth with your left hand. It will be almost impossible to try first. The first you take the brush and brush your teeth, your brush will be everywhere. It will never come too close to your teeth. But after a while, this is called neuroplasticity. That means if you practice, you get a habit forming, it will come to your mouth, you'll be able to start brushing. Guess what will happen? When you start brushing, your right hand will do like this. Because your brain is pre-programmed that you brush with your left hand. If you're shaving with the electric shaver, use your left hand to shave. All the time, use your left hand and left foot. Next, when you walk or when you get up into the step, always walk with the alternate foot. I mean, you have to walk. Like when you are walking, you put your right foot first, then the left, then the right, then the left. You'll see many people who has a fear of fall. First of all, they will be bending, they'll be walking like this, then they'll walk right first, then the right, then the right. Because they're right-handed. They're using their right side of the body all of their life. I've never seen a right-handed people doing a left foot like this. The always is a right. Same way, when you are taking steps, people who have a fear of fall, they will take a steps with like a right one. They'll go up to again the right one, again the right one, especially when they come down. When they come down, even they're holding the railing, the right one down, again the right one down, again the right one down. So, for a daily practice, use when you're getting up into the step, right foot, left foot. Right foot, left foot. Even it is difficult initially, hold on to your railing and go as slow as possible. Let everybody, if anybody is with you, tell them, please, you go ahead, I'm coming behind you. Right foot, left foot. Especially when you're coming down. When especially coming down, put the right foot first, then the left foot, right foot, and the left foot. People who have a problem with the knee joint, which all of us have, because knee joint, as I explained to you more and more, this is transmitting your body weight. It is not a weight-bearing joint. Weight-bearing joint is down below. Your ankle is a weight-bearing joint. So if your body is not in alignment, you develop a lot of problem with the knee joint. People who have a knee joint, the biggest issue is going down. Down the steps, that means, not only going up. Down the steps, they will be again going down to the right foot first, again right foot, again right foot. So what I tell them, that you get into the steps, hold on to your handrail, put your left foot first, then the right. And keep it back of your mind and continue every day. Yoga therapy is a holistic practice. A simple relaxation response brings the balance back. Tightness, like say people which say Parkinson's disease. In the Parkinson's disease, you are saying people are having a tremor. So tremor means it's continuous contraction of the muscles, tightness of the muscles, stiffness of the muscle. Like we teach people with Parkinson's disease the relaxation response. So what happened in relaxation response, even in Western medical concept, if you think about the disparity between the muscle tone and muscle relaxation causing imbalance, a relaxation response brings your balance back. So starting in the morning, if you're sitting, as I said, you always sit with your spine straight, and most of people who know by now where I'm sitting on your kneeling stool. Here is your kneeling stool. All of you know what kneeling stool is. When you sit down in a kneeling stool, it automatically keeps your spine straight. Here is your keyboard, here is your computer screen. Because the hunchback in front of computer is the root cause of all of our chronic diseases. You cannot get out of the computer, cannot do without work. So ideally, for working in a computer, you keep your spine straight, looking straight to your screen and keyboard at this level, so you can keep your back straight. A simple prayer pose to the back, like Paschim Namaskar, a prayer pose to the back will be very a simple and ideal relaxation response. So all of you have seen what a Paschim Namaskar looks like. Prayer pose to the back. Slowly put your hand wherever if it is. If it doesn't come here, if it is here, stay here. Keep your spine straight, eyes closed. You breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. Slowly your hands will come together. It will come to a prayer pose. And you stay in the prayer pose. Yeah, you can see. You stay in the prayer pose to develop neuroplasticity. Neuroplasticity will take between 30 to 40 inputs in the brain, but once you have the inputs, it gets embedded into the brain, so it gets, we call it, it gets etching in the brain. So if you stay here with your eyes closed, paying attention to your breath, breathing out longer than breathing in, slowly and slowly this thing is going to happen. Initially, muscle will contract to let you get into this pose. But if you stay in the pose a little longer and longer by establishing that neuroplasticity, muscle cannot remain contracted for too long. These are called stages of the asana. When muscle is contracted, it's called your arambha, beginning. Stay in the pose a little longer. The muscle starts to have a little fasciculation before relaxation. Then it quiets down. It's called your stability, sthiti. Beginning, stability, sthiti. Final stage of the asana is called your Visarjan. Visarjan basically is a surrender, and at that state, your body, mind, and spirit are united. Many people ask me, how does a asana practice affects the physiological and therapeutic benefits? The Western concept of asana is a external and internal alignment. That is a good concept. Western concept is that when you are doing a asana, say asana for diabetes, spinal twist, or we call it Ardha Matsyendrayanasan, we say it is causing massaging your pancreas. But at the end of the yoga therapy practice, it is that Visarjan, the surrender, the spiritual connection, the spirituality in asana, which affects your limbic system, the emotional brain, amygdala and hippocampus, and through limbic system, hypothalamic pituitary axis. The limbic system sends a neurotransmitter to the hypothalamus for homeostasis. Hypothalamus sends a signal first to the autonomic nervous system to balance both parasympathetic and sympathetic tone, and then it also sends a signal to pituitary adrenal axis to correct all the hormonal imbalances. The hormone of stress is your cortisol. So even here, I've been talking to you for a while. I've been putting my hand. I have a saliva in my mouth. My mouth is wet. And in fact, mouth is very wet. Because the saliva, the salivary glands are supplied by your parasympathetic nerve. The moment you have a parasympathetic activation, the moment you have a relaxation response, you will see your balance is coming back slowly and slowly. It's a very important phenomenon. We also practice, sitting in the mat. We'll do a cross-legged called Sukhasana, easy pose. Then you go to a stepwise Siddhasana, called a perfect pose. Then Ardha Padmasana, half lotus. Then a Padmasana lotus. But what we do, we change the feet. If the right one is on the top, then the next one will be a left one on the top. I'll show it to you when you get into the mat. Very, very important concept. Using both sides of the brain, both sides of the body will bring the balance back. Then you practice balancing. Practice balancing, you start standing, non-dominant foot. You're right-handed, stand on your left foot. Start behind the chair. Okay, let's go to the chair. See, we are talking about yoga therapy. We are not talking about a practice of yoga. You're trying to do a perfection in your poses. It's not the perfection of your poses, not perfection in the asanas, perfection in the practice. It is the using the physiological changes, therapeutic benefits to achieve a treatment of disease and maintenance of health. Sitting in a chair, as I always tell you, always sit down with your spine straight. Sitting in a chair, if you're sitting all the way to the back, still keeping your spine straight. Your body is like a 90-degree angle. Many people say, my feet doesn't touch the ground. If your feet doesn't touch the ground, put something underneath. I always prefer a folded blanket, because a folded blanket, when the neuroplasticity sets in, you can slowly take the fold off. So look at it, how simple it is. First, you're right-handed, right-footed, use your left foot. Put it here, sit down comfortably, look for two signs. First, no pain. If you develop pain, you back off. But stay, If you say, I'm not going to do it because it's hurting me, no, a little discomfort. What do you say? A comfortable discomfort is a very good sign. And then your effortless breath. What does the effortless breath means? That your lung and heart is the same organ. If you're doing a stress in your physical body, which is going to affect your heart, first it shows up in your breath. And effort in breathing. Same issue, if you got a stress in your lung, that means you have a effort in breathing, it will show up in your heart as a high heart rate, high blood pressure, and this health tracker is a wonderful, wonderful marker of your yoga therapy practice. You can see it. You can just go, just look at your heart rate, look at the EKG, look at anything, all the heart parameters. Slowly what you will do, you will get the foot behind the back. This is your Gururasana, eagle pose, sitting in a chair. We recommend for you to do it. It's a wonderful therapy for your knee pain, hip pain, all the low back pain. I will do this thing when I'm even having my dinner. I feel it goes like that underneath the table. Nobody knows. It is a personal life. So here, my left foot is in the top. Take my hand, left one goes in the top. I wrap it up, put my hands together. This is my eagle pose. Left foot wrapped around your right leg, left hand wrapped around your right arm and forearm and holding it together. Okay? Non-dominant side, you're doing an eagle pose. Many a time we recommend that since it's a non-dominant side, do it a little longer than the dominant side. But you also need to do it on the dominant side too. So now I'm right-handed, right-footed. My right foot goes high up, right foot comes around, it just wraps around. It's like an eagle pose, Gururasana. Right knee and right foot in the top, right hand goes high up, wraps around, and it goes around your left arm and left forearm. This is your Gururasana sitting in a chair. They all talk about chair yoga, this yoga, that yoga. Yoga therapy is an adaptation. Adaptation of your yoga practices. Yoga philosophy, 8 limbs of yoga based on your clinical condition. If you cannot sit in a chair, you can do standing up. If you can standing up, sitting down, sitting in a stool. Cannot do it even, do it laying down. Start from somewhere. You'll be able to do that. So, many things, always keep in your mind how to use both sides equally. That will bring the balance back. This time we'll ask you to practice, to practice the balancing. I'll ask you to do the balancing practice with a chair in front of you, or if against a wall, that also is okay. Chair in front of you. You don't want to take any chances. Okay, let's see. Mode. So what is the first practice going to be? First practice going to be, I'm a right-handed, right-footed. See if I can stand on my left foot. I'm standing with my hand in the touching the chair. Slowly I can let it go. I can let it go, and I keep on counting. 10 seconds, 20 seconds, 40 seconds. And during that, I can also do some of the balancing practices, hands on both sides. You can put your hands in a prayer pose in the front. Hands can go prayer pose high up. And also can do a prayer pose to the back. I'm still standing on my left foot. Next I see standing on the left foot, if I can stand with my eyes closed. Initially it will be almost impossible, but you will be able to do it. Stand on the left foot with your eyes closed and see how long you can do it. It's a very wobbly experience initially. Even I practice it every day, I cannot do it. One important experiential practice I want to share with you. Even I've been practicing every single day for many years. I'm noticing that first thing I'm losing my balance. So left foot. Now in the right foot. Same thing you can do right foot. And then you close your eyes. So if you close your eyes, see how long you can stay in the right foot. Longer and longer you do, better and better your balance should be. Because your balance is done through your eyes. And once you take that balance, your brain acts better. Holy yoga practices, out of 5 senses, if you lose one senses, the other sense becomes more acute or better. Say a person who is visually impaired, blind, see that touch. They can touch anything, again they say what it is by touching. Even they can touch the clothes and say what color of the clothes is. You can practice a tree pose, precaution. Left foot, hold on to your right foot, bring it up, hold it to a place, and see how long you can stand on one foot. Any issue, if you have any imbalance, touch it. Take it off, touch it. Take it off, stand here. Or you can put your standard tree pose. Another relaxation is, which we don't recommend you to do, we do not recommend you to do any pranayama standing up, because pranayama causes altered sense of consciousness. But a Kapalbhati pranayama is a very relaxation response. So you will see, if we can incorporate a Kapalbhati pranayama during our balancing pose, like a tree pose, how it will look like. Now I'm on my right foot. I'm taking my left foot, bringing it up, and standing on my right foot as a tree pose. You can get into a standard tree pose, hands on the sides, hands will go high up. Personally, myself, I always try to keep a chair in front of me too. So now here, what you can do, standing with this, it's a wonderful practice and wonderful experience. Tree pose, precaution with a Kapalbhati pranayama. Standing on one foot and spreading the other one outside, straight out, and your hand will go high up. Sorry. You know, this pose, this asana, which I have in the Facebook, because I've been doing it for a long time, but started losing it, because that's what we lose in the first time. And why it happens, I think at a certain time in your life, things are going to happen without you have any control or any balance. Our blood pressure goes a little high up when we age. We don't get older, we might get age, huh? So for a person at a certain age, we generally put a number 75. We call it that practice this relaxation response, and also from the physician standpoint, we say you a physician standpoint, you just we call it a maintenance. You don't need a preventive maintenance. And a lot of physicians started realizing now that, okay, if I'm lowering your cholesterol, giving you statin, it takes a certain time for this thing to work. Do I need a statin at this time? Because that's a preventive maintenance. Or at certain age, when person has already had 2 or 3 heart attacks, Now, person having a congestive heart failure, you said, yes, it is good to lower your cholesterol. The horse is out of the barn. Same thing, you are going to have some imbalance at certain time in your life. Our hemoglobin A1C goes high up. So, do we treat that? Of course not. Physician understands that. Our TSH, the thyroid function, TSH goes high up. So, a lot of time a physician gives a thyroid supplement based on the high TSH. But for a person of certain age, we recommend them, please, please. Check the free T4. Check the thyroid level in the blood before you give a thyroid supplement. Balance. Sitting down, your Sukhasana, easy pose. Take your both the feet underneath the knees, crossed, spine straight, hands touching in your Dhyana Mudra or Jnana Mudra, just over your knees. Close your eyes. Pay attention to your breath. Breathe out first to empty your lung. Slowly breathe in as long as possible without any effort, as if it is your normal breathing. Breathe out longer than breathing in. Muscles of respiration are skeletal muscles which you can train. You can train a skeletal muscle with the weight training. You can train the skeletal muscle with your practice. It will be very easy for you to do a 4-second out and 2-second in. Count of 4 out, count of 2 in. Count of 4 out, 1 and 2 and a 3 and a 4. Count of 2 in. Count of 4 out. Again, I want to show it to you. I'm talking to you. We're close to an hour, a little less than an hour. My mouth is still full of saliva. I have not touched any water. This is the sign of activation of parasympathetic tone. So once you are comfortable, which is called Sthiram Sukham Asanam, stillness, happiness in asana pose, you change your feet. You feel little discomfort at the initially. Just keep on practicing it. It will come back to you. The balance will come back to you. Then you slowly progress your level of asanas. Progressing the level of asanas takes you to do a better voluntary control of breathing, which is called pranayama, which is the 4th stage. Pratyahara, control of your senses. Dharana, focus, and enter into a dhyan meditation. Meditation is the 7th limb. Siddhasana, take your heel all the way to the back. For me, I'm taking the left heel towards my perineum, right foot on the top, and the right knee drops down. Same practice, Hasta Mudra, mudras in your hand, because mudras connects your body and mind. Eyes closed, closing your eyes, you control your five senses, like a pratyahara, and use your breathing. Exhalation longer than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. So it was left heel, now I bring the right heel close to my perineum. I took the left foot on the top and the left knee drops down. So even if it is high up, don't push it down, because adjusting doesn't help. Even if it is here, continue your relaxation response practice. It will happen on its own. From here, you take your one foot on the top, knee will come down. This is your half lotus, Ardha Padmasana, or your swastikasana. Level of comfort, Sthiram Sukham Asana. More you practice, more you will feel that how a relaxation helps you. So this was my left foot on the top. So balancing will be your right foot in the top. Ardha Padmasana, balancing. Yoga therapy for a better balance. It's not too much practices you need to do. What you need to do to stay in an asana long enough to create the relaxation response, and from going to the stages of asana, from beginning, arambha, to sthiti, stability, to visarjan, the surrender. Now I'm in a profound level of relaxation with Sukhasana, Siddhasana, Ardha Padmasana on both sides. I'm going into myself in a Purna Padmasana, a full lotus pose. Initially, you look at it and say, wow, how can you do it? This is a purely relaxation response. Once you get into the Padmasana, lotus pose, your whole body and mind relaxes. Remember, practice of yoga is not a reductionist. It is not the Western concept that this is relaxing my ankle, my knees, my hips, my lower part. It is relaxing your whole body, mind and spirit. It's affecting essentially your limbic system. We start with the brain stem. Brain stem is your most primitive brain. Brain stem controls all of your vital functions. All the cranial nerve comes from the brain stem, then goes high up. It is called your supratentorial area, tentorium cerebri. There is your cerebral cortex. Below the tentorium is the cerebellum. which is more for your balancing, other functions. So the brain cortex, which is your both sensory and motor, now you're going beyond that, which is your limbic system, amygdala and hippocampus. Amygdala responds to fear, and stress is nothing but a fear of unknown. And hypothalamus responds to your memory. Neuroplasticity sets in. Chronic practitioner of yoga, it will see structurally that amygdala, hippocampus, prefrontal cortex gets more bigger and thicker. So here my right foot was in the bottom, left foot was in the top. Okay, that was my lotus pose, Padmasana. Right is in the bottom. Next step will be the left foot is in the bottom as a Ardha Padmasana. What a wonderful practice. From here you go to your, now right foot is in the top. Padmasana, your opposite leg, activating opposite side of the brain. What else can you do? So, it's not the practices, it is the concept keeping back of your mind. Activating both sides of the brain. Activating the balancing poses. And activating your sit-rise test. Able to get up from the ground without a support. And also you have seen that you don't get in right in and out. You take your time, put your foot higher. Take your time. Follow your breath. Follow your sensation of pain before you progress. So, we showed you all the time how to get up without a support. You can sit down in a malasana. You can sit down in a malasana. It is a wonderful relaxation. You can put your one elbow inside, other elbow inside. Keep your spine straight. Hands gets relaxed with the separation of your fingers. Wrist gets relaxed. Close your eyes and able to get up without a support. To bring the balance back. On the other hand, if you go all the way down into the ground, from this ground into the ground, you can get up without a support. Right foot on the right side, left foot here. So, in a regular practice, now you go back onto the floor, cross your feet. Crossing your feet, see if you can get up. Crossing your feet, see if you can get up without a support. If the same thing, you can do a Savasana. You can all the relaxation, all the practices. A Brahmri Pranayam. brings a profound level of relaxation because it acts through your pratyahara. Your five senses, you shut down your five senses, then you create a vibration through the sound of a bumblebee. Our brain and the body has a vibration. Two vibration interacts, cancels the power of your harmonic resonance. Index finger on your third eye. You can use a Shanmukhi mudra, or you can use your three fingers to close your eyes. Use your thumb to close your ear, close your mouth. You'll breathe out first. Take a deep breath in and breathe out with the sound of a bumblebee. Breathe out first. Deep breath in. Again, one more time. When you develop cough, that means the air which you are breathing through your nose, remember you always breathe through your nose, you are breathing through your nose, it is really touching your larynx, the vocal cord where the cough reflex comes. Breathe out first. Deep breath in. Pumping and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. It will relax your ciliary muscles. It will relax your all the muscles of the eyes, which are supplied by 4 cranial nerves, SO4, LR6, superior oblique supplied by 4th cranial nerve, lateral rectus, LR, lateral rectus supplied by 6th cranial nerve, retina is connected to your optic nerve, and the 5th nerve, trigeminal nerve, comes in the outer side. Take your hand, massage your forehead. When you're massaging your forehead, the muscles get relaxed, and these muscles are attached to your skin. So all the frowning goes away. All the lines in the facial lines goes away. Massage in your earlobe, massage behind your ear, in the external ear canal. There's a branch called auricular branch of the vagus nerve. It stimulates your vagus nerve. If you stimulate a little bit of the external ear canal, you will see that you elicit a parasympathetic activation. Bring your hand, massage the side of your neck. This is your carotid sinuses. Massaging carotid sinus gives you the relaxation of the cardiovascular system and the nervous system. The hand to the back. Relax your occipital tubercle, the insertion of the sternomastoid muscle and the accessory muscle. It is supplied with the cranial nerve. Anulom Vilom Pranayam, alternate nostril breathing, is the most balancing of all the pranayamas because it activates both sides of the brain. Use your left hand, use your Dhanu Mudra or Gana Mudra, touching the index finger and thumb, putting it on your knees. Right hand, close your right nostril. You don't have to push all the way down, just underneath, just gently with the thumb. First, breathe out through your left nostril. Then breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Continue your alternate nostril breathing and also incorporate your concentration by putting your index finger and middle finger on your third eye. And close your eyes, bring the focus in the third eye and continue your alternate nostril breathing. And let me explain to you. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is parasympathetic. Right brain is cooling. Left nostril breathing is called cooling. Chandra Nari, like a moon energy. It is also a parasympathetic activation. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is male. Left brain is hitting. Left brain is sympathetic. Right nostril breathing is called Suranari, sun energy hitting. It is also sympathetic. Alternate nostril breathing stimulates both sides of the brain. A meditative practice is your accessing your subtle body. We have three bodies: gross body, subtle body, and causal body. And also remember, balancing in yoga practice is balancing your three bodies: 5 koshas, the sheath, 7 chakras. And when you are in a balance of your body, mind and spirit, you unlock. Remember the word, you unlock the potential healing power within you. The body can produce every medication you take from outside. This is the tapping, unlocking the healing power within you. A super brain yoga is also a wonderful balancing practice. It has been done very often. We used to see that in India, the children, the children who are not compliant, they cross their hand and hold the earlobe. Right hand will hold the left earlobe and left and right earlobe. And from this posture, they will sit up. Sit down, get like that. Breathe in, breathe out. Keep doing it. You will be in a proper balance. In Western term, money back guarantee. Finally, let's end up with a practice which initially looks almost impossible, but it is possible. When I'm in a good yogic meditative practice, I access my subtle body. My subtle body is the body of my memory. I'm looking at my body whole day and night. I don't need any light, I don't need anything to access any part of my body. With my eyes closed, I can touch the tip of my nose, up. The left hand, I touch my right shoulder. With my right hand, I can touch left little finger, can touch my right heel. Anywhere in the body I can touch. So when you concentrate, you'll be able to do alternate nostril breathing without closing your nose. Both hands in a dhyana mudra or a jnana mudra, index finger touching your thumb, putting over both of your knees. Close your eyes. Bring your attention to the left nose. You will be doing in silence, but I'm just going to guide you a little bit. So I'm going to talk for a short time, then you will do it in silence. Bring your attention to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing out through my left nostril. I'm breathing in through your left nostril. Now in silence, Keep doing it for a while before you enter into your eighth limb, Samadhi, which is a union of your body, mind and spirit. You will feel that your mouth is wet, your body is completely relaxed, relaxation response and parasympathetic activation will set in. Slowly bring your hands in front of you. Touch your little finger and thumb. Open up the ring finger, middle finger and index finger. Lotus Mudra, Padma Mudra connects your body, mind and spirit. Slowly bring the Lotus Mudra towards your heart. Heart is the site of your soul. Recall, memorize by heart. In yoga practice, we say, what is your hand? The hand mudras. That's what your eyes goes. Eye looks in your hand. Whatever eye looks at it, it goes into your brain, called your mind. What happens in the mind, it comes to your heart, side of your soul. What happens in your heart, it goes to your emotions. There is 9 emotions. A balance of the yoga therapy practice gives us a physical, mental and spiritual well-being. Brings us health back. Bring your hands together in front of your heart chakra, anahata chakra. Bow your head down. You say namaste. I honor the divinity within you. Wonderful practice. Yoga therapy to bring a balance back, and for people of certain age, it is the practice of yoga for 2 particular things. First is for the chronic pain relief and also bringing the balance back. Once you bring the balance back, your mortality will go down. Thank you again. I think I'm here for next few Saturdays, unless I have some presentation or if I travel. Otherwise, I'll come back. Again, please make a comment or a question, and I promise sometimes I'll come and answer those for you. Okay, bye-bye. See you next Saturday.